Have you ever felt stress or pain and you're not quite sure how to deal with it? Have you felt tempted to try drugs or alcohol as a way of coping with stress or pain? Stress and pain are a part of life. Many teens turn to drugs and alcohol as a way to feel better. Not only are many of these substances illegal, but when used too often in too large amounts or for the wrong reasons, they can be very dangerous. There are a wide variety of drugs and alcohol, we will call substances, that are used to feel good or high. These include legal substances, like prescription medications, caffeine, and household chemicals such as glues, aerosols, and cleaners. Substances legal for adults, but illegal for teens, such as alcohol, nicotine products like hookah, cigarettes, and e-cigarettes. Marijuana, which is legal for adults in some states, and illegal drugs like cocaine, heroin, and methamphetamines. When your brain is exposed to one of these substances, the substance triggers areas of your brain that make you feel pleasure. Some people want to feel that pleasure over and over again, so they continue to take the substance and may take it in larger amounts. They may come to a point where the body and brain need the substance to feel normal. This is called addiction. It's important to seek help before addiction takes over your life. Warning signs of addiction include using a substance for a long time and needing more to have the same effect, always thinking about finding and using the substance, craving the substance and not being able to stop using it, substance use that affects school or sports performance, work or relationships with family and friends, missing school, work, or social events in order to use the substance, using the substance even when it can be dangerous, like before driving. Seeking treatment for addiction can be difficult. Friends and family members may be the first to notice changes in behavior, mood, and physical health. If friends and family are concerned, it's time to seek help for treating the addiction. Your healthcare provider will do a thorough physical examination and medical history, and ask questions about your use habits. Your healthcare provider will also want to find out if you have any other physical or mental health conditions which can affect the treatment process. Most people need a long-term plan to stop using these substances for good. Talk with your healthcare provider or a mental health professional to find a treatment plan that will work best for you. Treatment options may include a detox program. This program will include care from trained staff who watch your heart and blood pressure closely. They may use prescription medicines to keep you safe as your body cleanses the drugs from your system. Medications can also help remove the remnants of chemicals in your body left over from your substance use. Talk therapy with substance use treatment counselors, medicines to treat addiction and prevent relapse, and support groups. You may also work with a counselor to come up with a plan to help you stay drug and alcohol free. Your plan may include finding support systems. This might include only spending time with friends who are also drug and alcohol free. Having a plan for what to do when you feel tempted to use. Remember, it's okay to say no. Participating in new activities to replace old habits. Finding other ways to manage stress and emotions, such as meditation or deep breathing, exercise, spending time in nature, listening to music, or talking with a trusted friend or family member. And choosing a support program like Alateen or Teen Anon. Quitting can be very difficult and uncomfortable. If you ever feel like you may hurt yourself or others, or have thoughts about taking your own life, get help right away. Call 911, a suicide crisis helpline, or go to your nearest emergency department. Addiction can be very harmful to both you and those around you. For some drugs, all it takes is one time for addiction to begin. Drug use can lead to motor vehicle crashes and other accidents, overdose, and death. The best way to avoid the consequences of drug use and addiction is to avoid starting in the first place. Drug addiction is a condition that is both preventable and treatable. Work with your healthcare provider, counselor, and family to come up with a plan to give you the best chance of getting and staying clean.